In this video, we will discuss Alport syndrome, a rare genetic disorder primarily affecting the kidneys. We will cover its inheritance patterns, clinical features, diagnostic criteria, management options, and its relation to other glomerular diseases. Alport syndrome is a hereditary kidney disorder primarily transmitted through the X chromosome. It usually affects males who inherit the mutated gene from their mother. Females are typically carriers with milder or no symptoms. Less commonly, Alport syndrome can also be inherited in an autosomal recessive or autosomal dominant pattern. The disease-causing mutations are found in the COL4A3, COL4A4, and COL4A5 genes, which produce proteins involved in the formation of the glomerular basement membrane. Molecular genetic testing can identify these mutations, aiding in diagnosis and family counseling. Type 4 collagen is a key component of the glomerular basement membrane, GBM, in the kidney. Mutations in COL4A3, COL4A4, and COL4A5 genes disrupt the production or assembly of type 4 collagen, leading to a weakened GBM and Alport syndrome. This compromises the kidney's barrier function and allows the leakage of blood cells and protein into the urine. Moreover, the abnormal GBM triggers a series of cellular and molecular events that result in renal fibrosis, a characteristic feature of chronic kidney disease and Alport syndrome. Alport syndrome presents with a range of symptoms, including blood and excess protein in the urine, and progressive kidney damage. The severity and age of onset differ among males and females, as well as in different genetic forms. Diagnosis involves considering symptoms, family history, genetic testing, and sometimes a renal biopsy. Renal biopsy provides important information for diagnosing and assessing kidney damage in Alport syndrome. Histopathological examination reveals characteristic changes in the glomeruli, including irregular thinning, thickening, splitting, and laminations of the glomerular basement membrane. Abnormalities observed under electron microscopy include a basket-like GBM structure, irregularities in collagen fibrils, and foot process effacement in podocytes. Immunofluorescence studies may show reduced or absent expression of collagen 4 chains in the GBM. These biopsy findings, along with clinical and genetic data, aid in accurately diagnosing and classifying Alport syndrome. Alport syndrome not only affects the kidneys but can also involve other organs and systems. Common extrarenal manifestations include hearing loss, eye abnormalities such as cone-shaped lens and retinopathy. These require careful monitoring and management for optimal patient outcomes. Renal fibrosis in Alport syndrome involves complex interactions between different cell types, including mesangial cells, podocytes, fibroblasts, and immune cells. Persistent injury and abnormal remodeling of the glomerular basement membrane activate profibrotic signaling pathways, leading to excessive production and deposition of scar tissue components. This disrupts kidney architecture and impairs function. The management of Alport syndrome aims to slow the progression of renal dysfunction and manage associated complications. Supportive measures include blood pressure control, proteinuria reduction, and renal protection strategies, such as angiotensin-converting enzyme inhibitors, ACEs, or angiotensin receptor blockers, ARBs. These medications help mitigate proteinuria and blood pressure, subsequently slowing the decline in renal function. Regular monitoring of kidney function, including estimated glomerular filtration rate, EGFR, and urinary albumin excretion, is crucial for assessing disease progression and guiding therapeutic interventions. In specific cases, renal replacement therapy, such as hemodialysis or kidney transplantation, may be necessary. Genetic counseling plays a crucial role in Alport syndrome due to its hereditary nature. Counselors help affected individuals and their families understand the inheritance patterns, the risks of transmission to future generations, and the availability of genetic testing options. Identification of disease-causing mutations in affected individuals allows for more accurate family screening and testing of at-risk family members. Genetic counseling provides families with the knowledge and tools necessary to make informed reproductive decisions and helps manage the psychological and emotional aspects associated with a genetic disorder diagnosis. Understanding the relationship between Alport syndrome and other glomerular diseases is essential for accurate diagnosis, appropriate management, and prognosis. Alport syndrome shares some similarities with other glomerular diseases, particularly those affecting the basement membrane, such as thin basement membrane nephropathy, TBMN. Differential diagnosis relies on a combination of clinical features, family history, renal biopsy findings, and genetic testing. Distinguishing between these disorders is vital, as the long-term implications and management strategies can vary significantly. Research in Alport syndrome aims to understand new disease mechanisms, develop better diagnostic tools, and discover potential treatments. Recent studies have revealed alternative pathways involved in disease progression. Gene therapy, RNA interference, and stem cell-based therapies are being explored for their potential to restore kidney function and stop disease progression. These advancements offer hope for improved outcomes in individuals with Alport syndrome. Renal transplantation in Alport syndrome requires careful consideration. Donor selection is important to avoid recurring disease. Genetic testing should be done to minimize risks. Post-transplant monitoring is crucial. Long-term outcomes are generally good with proper management and follow-up. In a video discussing Alport syndrome, we explore the challenges of restoring the damaged glomerular basement membrane. Potential therapeutic options include gene therapy and stem cell-based interventions, both of which offer hope for restoring kidney function. Ongoing research in these areas provides optimism for potential treatments in the future. In conclusion, Alport syndrome is a complex genetic disorder affecting the kidneys. Understanding its inheritance patterns, clinical features, and management strategies is important for patient care. Ongoing research offers hope for better outcomes and targeted interventions.